Is it there now?
No.
Fine. I mean,
I can see it.
I can see it.
oh, there we go. What's up with your computer, Donny?
My phone is tired.
Okay, oh bless. Fine. So I'm going to talk just a little bit. I've just thrown these slides together, and I suspect my colleagues will be able to jump in and help me more with this, so we can have a group discussion. Because really, I think we want to take this out to how can we help you, as opposed to, well, it's a two-way thing, isn't it? But it's all about how we can get better communication, get these kids seen correctly in the right place. Right, hang on a minute. So essentially, I think everyone knows this, but I was just trying to clarify it in my own head. Referrals to children's services, how there are essentially three, I think, possibly four ways in. So acute same day, that's quite straightforward. Hot phone, I'll put the number somewhere up in a minute. Call for advice, review in ED, that's quite straightforward. Anything that's acute the same week or the same fortnight, again, call the hot phone to discuss. We can make a decision. Is it appropriate for Blue Sky, our ambulatory unit? Is it appropriate for hot clinic? Anything non-acute, referral to outpatients. I'm not saying that every referral to hot clinic needs to be discussed. It absolutely doesn't. But if there's a query about it, if you're not quite sure where the best place for it is, then please give us a call. Of course, we also have our Together Clinic service, in which children with sort of depending on how often the Together Clinics are running, but children with the slightly less acuity that don't need to be seen that same week can be seen as well. So there's that point as well, which Marianne will shoot me if I don't talk about. So I'm sorry it's not on that side. It absolutely should be. Together Clinic's very important part of this. So basically, the hot phone, I've put the number up there, but please don't give this number to parents or patients. I know that nobody would, but we've had a few direct calls from parents to the phone recently, which isn't really appropriate. So I'm just saying that. It is really busy. We just ask you to bear with us. We get up to 30 calls a day, as well as trying to run the Blue Sky unit and A&E emergencies, and answer advice and guidance. So it is busy. We always try really hard. I often have people on hold going, I'll come back to you. It's the primary point of contact for anyone around the hospital wanting peds. So it is busy. Please bear with us. We will always try. We also don't have any phone reception in A&E where we might be. But if you can't get through, the phone's off, please try Blue Sky or the Paediatric Reg, because those and leave a message and we will come back. I guess this is more about hot clinic referrals, but also about those phone calls, is that we're not all paediatrics. We are the point of kind of call for everything, but we can't see everything. We can certainly tell people where to come, where to go, where to send people. We have paediatric ENT and orthopedics and all sorts of specialties in the hospital. Now, often those referrals need to come straight through us anyway, but we will try very hard to direct people to the right place. What else did I say? Okay, I'm just going to talk about the cancer referrals and then hot clinic referrals, and then I'll let everyone else have a chat. For the cancer referrals, yes, there is a pan-London referral form for cancers, and that's the kind of formal 2-week rule thing. But the first line does say, please contact the on-call paediatrician, and that is so important because the 2-week rule office in St George's is not in paediatrics. And if there's no phone call, those referrals, it just gets delayed because it goes there, and then they have to email me, and I have to. So it does work, and sometimes that is completely appropriate. So there are some things that are best seen by others. The two obvious ones are anything that feels like a breast cancer. Be very unlikely in a young person, but it's still possible. Breast lumps they have a whole pathway through the Rose Centre, and that needs to go there. And thyroid cancer needs to go via ENT. But even those, will take a phone call and just tell you where to send that. But lumps and bumps and things, please call us. Obviously make the referral, but please call us because we can get that into hot clinic or Blue Sky the next day if we need to, or A&E if that's appropriate. But I guess my plea is please call us on the hot phone. It is part of the pathway, and it does often get forgotten, and I understand why, but it's really important so we can get these children seen really quickly. And then my other little slide was about hot clinic referrals, which I'm sure Giordano will also jump in on. And I guess our pleas to everybody, and we rewrote our form, I hope it's gone out, is the hot clinic the best place to be seen? Often it is, but there might be more appropriate services. So Together Clinics, if a child is not local to St George's, or Wandsworth or Merton, Do they need, so if it's a child who needs, for example, speech and language or physiotherapy, those things are borough based and we don't have access to those, for example, in Lambeth. I mean, we can refer, but it's very difficult to coordinate care that way. So if there's a more appropriate centre, and near a hospital that might be more appropriate, that's, think about it, I guess. And also remember it's general paediatrics. So we've had referrals from outside of London sort of wanting a quick way into paediatric neurology or some of the tertiary services. That's not what Hot Clinic is for, and it's not, we can't do that. And in that case, that might be more appropriate to go locally. Um, I guess our plea on our referral forms is, what's the clinical question that needs answering? I know that sounds straightforward, but sometimes it's really not. But if in doubt, please discuss with the hot phone consultant on the phone, and please also then put the name of the consultant you've discussed it with, because it really helps us with our triaging. If the referral is rejected, but you don't have to talk to people, it's fine. You know, we're all grown-ups, but if it's something that needs, there's a query or it needs finessing, then just have a chat with us. We're all pretty friendly. And if the referral is rejected, and the explanation will be sent back to the surgery. Usually, if you need to discuss it further, please call us. And that my question is, what can we do to help you? There's a question. Can I use hot phones with my practice being in Surrey? It's a good question. I guess, you know, the hot phone is for, we're a local paediatric service. It's for our, you know, primarily that is set up and paid for by Wandsworth and Merton boroughs. But, you know, we recognise we work in quite a geographical area that hits sort of 6 or 7 boroughs actually. I guess it would depend what the question was. You know, if you're in Surrey and there are paediatric units closer to you, then that's probably the more appropriate forum to direct your question to. If it's because you need, you know, access to one of the tertiary services, again, there's probably a more appropriate way to do that via secretarial teams. We can possibly direct that. But we try. It's tricky because we, you know, we want to be helpful, but you know, we have to focus on our boroughs patients. However, we do. I mean, I've got patients in my clinic who live in Surrey, so if there are patients, then absolutely. I don't know. What do Maya and Giordani think? Who else is on this call?
Yeah, I'm not sure that we can help a lot. If they ought to be going to their local services. So unless they're known to us and our patients, you're better off contacting your local service, because that's where the patient needs to be seen. You know, we'll always happily answer questions, but it doesn't make a lot of sense to be phoning a different borough when you've got paediatric services locally, as I said. But if it's one of our patients, then 100%, absolutely.
I fully agree. Really, it's. I mean, I had a call from GPs from Norbury or from Leatherhead, and I just feel the advice may be the best one because you could not get access to a pediatrician in your area. But then it doesn't make sense a child traveling from Leatherhead, crossing Epsom, St. Helier, and then coming to St. George's to be told, oh, that's okay. This was just a bit of post-viral lymphadenitis. And if I were the parents coming from there, I would be cross. So I think it's a matter of rethinking about what will be the outcome of the telephone call and the implications to the family.
Yeah, I guess it's the right care in the right place at the right time, isn't it? It's part of that. Is there anything about our referral process that is annoying, that is unclear, that we can do better, I guess? I doubt that means no.
It's nearly 5 o'clock. Can I add something about the 2 weeks referral? I think we are in the world of technology where it's probably much easier to fill a form and then to push a button on the computer, the form is sent. But actually, the 2-week referral makes things more delayed than calling in the hot phone. Emma, you said it. I think we should stress on that. We've got the phone, even if we may not respond to your call, you may have to call us 5 minutes later because it's very busy. But you get on the spot decision making where we will say we're going to see the child today or tomorrow or the following week. That obviously it doesn't replace the whole cancer referral, but you're worried. And if you put yourself in the shoes of the family, probably they want a decision being made when the child can be seen. It will be much, much quicker with the hot phone. Please call us.
And I think it's important. I mean, that 2-week review, that form still has to be filled in because there are some things that don't come via us. So thyroid cancer and what was the other one? Breast cancer is the other one that doesn't come through us. So the forms do need to be filled in. But if there's a call first, we can sort of start things going and say, I know, just fill the form in and it'll get through to ENT, or no, we'll see this or whatever. So it does need to be filled in, but it's the call first that's the important thing. Hopefully, though, actually, that's not too many because there's hopefully not that many. There's a question I've just seen. Can patients be seen from other boroughs using Choose and Book? Yeah, I mean, I guess it's the same answer. Yes, of course, we sit in Wandsworth, but Merton's practically the next street to the hospital. But we are almost, Futton's very near, Lambeth's very near, Croydon's very near. We sit in a borough in London is tiny. The boroughs are where they are. So if it's the right thing for the patient, then yes, of course. What I think is not the right thing for the patient, as Giordano said, is if they come from Surrey and need to drive past hospitals where there are other paediatricians to come and see us, then there is this patient choice thing. But again, it's about getting the patient seen. It's what's best for the patient, right? Seeing the patient in the right place at the yes, we slightly need to protect our local boroughs because that's who we are funded to what's the word I'm looking for? Provide services for. But we would not turn down a patient who lives in Lambeth or Croydon or in near us if that's the right thing for that patient. We don't. I think we would take exception to seeing someone who lived not in a borough that was adjacent to ours, just because there are more appropriate places for that child to be seen. And for example, because we see children up to the age of 18 or young people up to the age of 18, we've had referrals from Northwest London, from East London, where we have just said, absolutely not. There are much closer services. There's always a bit of a grey area if it's very near, and there is also patient choice. But actually, as a general rule, the boroughs that surround St George's, we wouldn't say no to, essentially, unless there was a really good reason. But yes, we would if they had to travel over the River Thames, I suspect. Does that sound about right, guys?
Yeah, that sounds right. And there is a message from Caroline mentioning that the hotline is useful, which is amazing.
Oh, that's good to hear.
I was just going to emphasize that we are a group of general pediatricians. I think a lot of people refer to St George's because they think they'll get a whole lot of specialty service. But actually, the point about going to your local service is they are general pediatricians as well and can refer just as well as we can to the specialist team. So we're not providing a different service or better service than those other local hospitals.
Yeah. Should I add one little thing about when we get called on the hot phone? I've seen GPs being disappointed when they call and they actually stress, can the child be seen on Blue Sky? And I say, no, the child is going to A&E. And you can feel the GP saying, really? Why are you doing that? As if something wrong I am doing. It's just for you to be aware. When you call us, we have an overview of the whole St. George's pediatric services, which means the wards, the Blue Sky, the A&E, and we have to decide where the patient goes depending on the reason you called, depending on our predictability of the management. As a simple thing, if you send me a child who has got a headache, in the history, it sounds like the child has got a tumor. That child will not come to Blue Sky because I'm anticipating he will need a scan. So the best place to go is any where the CT is going to be easy to organize. So, and the other thing, Blue Sky may be busy, may have no doctors that day. So please understand when we make a decision, when you call us, they are based on a lot of factors which are to do with the activity and the service in the St. George's.
I mean, my feeling is that actually, I mean, I've been at George's for 6 years, and this whole ambulatory service hot phone was just starting when we started, as was the Together Clinic. And actually, in the 6 years, the service that we provide just changed massively, and I think for the better, because we work so much more closely with primary care and doing care jointly, and the communication. And I think, you know, the children certainly benefit from that. So, you know, I guess we're kind of finessing it now. Really, we're on the small points now to try and finesse. But yeah.
Yeah. Any more questions before we wrap up? Vicky, probably you take again the baton. There are no questions.
I can't see that there's any more questions. I was just completing the feedback form to send out to all the participants.
Yeah, and please, if they can give a feedback, tell us what they want for next sessions, so that really I can try to get the speakers, the area I know the topics, the more likely we will match what GPs want to learn. If that doesn't happen, then we have me and Vicky, we have to sort out the list of topics which may not match the needs of the GPs. So please let us know. The other thing, we're going to try to make sure next one, and probably from next one, we do face-to-face, because it's good to meet the GPs, to mingle around, know each other, and that will be useful. So please give us feedback.
Yes, if anybody has any comments on going back to face-to-face, Deanne and I are very keen to go back to that. The struggle that we had was finding any sort of venue within the next sort of year and a half within St. George's. So we're going to book for next year now, and we would love to be able to see people face-to-face.
Yes.
Right. So if that's okay with all our speakers today, if I can forward your presentations to the GPs who attended, and a couple who've said that they weren't able to attend and they would really love some information, I'll send those out.
Thank you. Thank you for organizing this, Vicky.
Well, thank you to you all as well. You've taken a lot of time today. I'm really grateful.
Thank you. Thank you, everyone. So we wish you a good and nice Friday and relaxing weekend, hopefully. Thank you. Until next time.
Thank you, Johnny.
Thank you so much. Bye-bye.
Thank you, everybody.
Thanks,
Bye-bye.
everyone.